The true number of people who have died because of the COVID-19 pandemic is 3 times higher than the official toll, according to the World Health Organization.
It estimates nearly 15 million people died from the virus and because they couldn't access healthcare. Ashley Yates has more.
Makeshift crematoriums in India, mass graves in Brazil. A pandemic we thought had killed 5.4 million people. The World Health Organization now says is more likely to have taken the lives of 14.9 million.
This excess estimate represents 9.5 million more deaths.
What it calls excess deaths are the number of extra deaths that happened compared to what each country would normally expect had there been no pandemic. It also includes those the WHO believes died from knock-on effects, like patients not getting treatment because of overwhelmed health systems.
Most of the excess deaths, that's 84%, are concentrated in Southeast Asia, Europe and the Americas.
In the report, Mexico's excess death toll was twice as high as the government claimed, Egypt's 12 times higher, and Pakistan 8 times more.
Reporting deaths from COVID-19 is important to monitor the impact of the pandemic and the response.
The new data estimates India's excess deaths were 4.7 million by the end of 2021, almost a third of the global toll. That compares to India's officially recorded toll of just 481,000. Its government's labelled the WHO's methodology as flawed. It's been the opposite in New Zealand, according to one epidemiologist.
If anything, we may be actually overcounting deaths from this infection. But one of the things that's really remarkable here is actually we don't have excess mortality over the last 2 and a bit years since the pandemic started.
Over 7,000 community cases were recorded today and 24 deaths. The worldwide death toll has been labelled a tragedy by the WHO. Some lives that have been left uncounted by COVID.
Kia ora, Ashley. Now you've got some information about a medical workers' strike on Monday.
Yes, Mike, 10,000 allied health workers are going through with their work to rule strike action on Monday after months of failed pay negotiations. Now, this affects a wide range of medical staff, including anaesthetic and laboratory technicians, as well as staff and dentists. The unions say they're still hoping for an offer from DHBs to avert this strike action, which also includes a 24-hour strike scheduled for the 16th of May. The union says that these workers can't afford to pay their bills while some staff are leaving for higher paid jobs at KFC. It is important to note here that this pay dispute is different to what nurses are working through at the moment in terms of their pay equity settlement offer.
Ashley, tēnā koe.